Cynthia Akini has come for a consultation to Kenya's Diabetes Management and Information Center. For the past 5 years, the center has supplied her with insulin at no cost and helped her manage her condition.
Like when we come here, our sugars are in control. They're going to give us the information on how to continue the best control. And if they are bad, we're going to get advices. We're going to see our fellow colleagues who are good.
She is part of a growing number of type 2 diabetics living in Africa, and many of those patients need insulin. That's where fears of a shortage come in. A recent study by the Lancet Diabetes and Endocrinology Journal predicts the amount of insulin needed to treat type 2 cases will rise by more than 20% over the next 12 years. But researchers say only about half the patients who need it at that time will be able to get it. Africa and Asia are set to be the hardest hit.
It's predicted that increase, most of it will be in Africa and the Asia countries or the continent. And Africa, we're actually doing badly because our increase will be almost 50%.
3 companies dominate worldwide production of insulin: Novo Nordisk, Sanofi, and Eli Lilly. Dr. Jenga said she discussed the issue with representatives of Novo Nordisk, who tell her they're prepared to meet future needs.
That is the notion that we're going to have a crisis of insulin. But they say if countries were able to judge or to actually establish the actual need, the situation, do a situation analysis on the ground, find out how much insulin the country needs, and order in time, they will get the supplies.
But supply is only part of the problem. Its cost is another. Dr. Jenga's center helps patients pay for their treatment. She also understands how poor planning by health authorities can eventually hurt patients like Cynthia. In partnership with Kenya's Ministry of Health, Dr. Jenga is helping to compile a registry of all of the country's diabetics, giving them the data needed to plan ahead and avert a crisis. Astatal for CGTN in Nairobi, Kenya.